You might be surprised at how often people struggle with mental health challenges. Have you ever wondered what the most common mental health disorders are? It's a topic that affects way more people than you might think, and understanding it can help us all be more supportive and compassionate. Anxiety disorders. Let's start with anxiety disorders. You've probably heard the term anxiety thrown around a lot, but it's not just feeling nervous before a test or a big game. Anxiety disorders include things like generalized anxiety disorder, where people worry excessively about everyday things, and panic disorder, which involves sudden and intense panic attacks. There's also social anxiety disorder, where social interactions cause overwhelming fear, and specific phobias, which are intense fears of particular things, like spiders or heights. These disorders can make daily life really tough for people. Depressive disorders. Next up, we have depressive disorders. Depression isn't just feeling sad for a day or two. It's much deeper than that. Major depressive disorder is one of the most common mental health conditions and involves long periods of sadness, hopelessness, and even a loss of interest in activities people once loved. There's also something called dysthymia, or persistent depressive disorder, which is like a low-level but long-lasting form of depression. Both can have a huge impact on someone's life. Bipolar disorders. Bipolar disorders are another group worth mentioning. These involve extreme mood swings that go from high energy, euphoric states, called mania, to deep depression. People with bipolar disorder experience full-blown manic episodes, while those with bipolar disorder have less intense highs, known as hypomania. Along with episodes of depression, imagine feeling like you can conquer the world one moment and then not being able to get out of bed the next. It's a roller coaster, to say the least. PTSD, post-traumatic stress disorder, is something you might have heard about in relation to veterans, but it can happen to anyone who's gone through something really traumatic. People with post-traumatic stress disorder often have flashbacks, nightmares, or intense emotional reactions to things that remind them of the event. It's like their brain is stuck reliving the trauma. OCD. Then there's Obsessive-Compulsive Disorder. This isn't just about liking things neat and organized. It's a condition where people have unwanted thoughts, obsessions, and feel driven to do certain actions, compulsions, to relieve their anxiety. For example, someone might feel like they have to wash their hands 20 times in a row to feel safe. ADHD, Attention-Deficit Hyperactivity Disorder, isn't just a childhood thing. While it's often diagnosed in kids, adults can have it too. Attention-Deficit Hyperactivity Disorder affects focus, impulse control, and organization. You might know someone who's super forgetful, easily distracted, or always on the go. They could be dealing with attention deficit, hyperactivity disorder, eating disorders. Eating disorders are another category people don't always talk about. Anorexia nervosa involves extreme food restriction and a fear of gaining weight. Bulimia nervosa includes binge eating followed by purging, like vomiting or using laxatives. Then there's binge eating disorder, where someone eats large amounts of food but doesn't purge. These disorders aren't just about food. They're deeply tied to emotions and self-image. Substance use disorders. Substance use disorders, or addictions, are also common. These happen when someone becomes dependent on drugs, alcohol, or other substances, even when it's clearly harming their life. Addiction is a mental health issue, not just a lack of willpower. and it's something that many people struggle with. Other disorders. There are also schizophrenia spectrum disorders, which include conditions like schizophrenia. These involve symptoms like hallucinations, delusions, and disorganized thinking. Personality disorders, like borderline personality disorder or narcissistic personality disorder, can also affect how people relate to others and handle emotions. And let's not forget neurocognitive disorders, like Alzheimer's disease, which mainly affect memory and thinking as people age. Why this matters. So, why should we care about all this? Because mental health is just as important as physical health. These disorders affect millions of people, and chances are, someone you know is dealing with one. By learning about them, we can reduce stigma, support each other, and encourage those who are struggling to get the help they need, whether it's therapy, medication, or just someone to talk to. Help is out there. If you've made it this far, thank you for taking the time to learn about mental health. It's a big step toward making the world a more understanding and compassionate place. Mental health disorders are more common than many realize, and understanding them can foster compassion and support. Common conditions include anxiety disorders, such as generalized anxiety disorder and panic disorder, depressive disorders, like major depressive disorder and dysthymia, and bipolar disorders, characterized by extreme mood swings. Other notable conditions include post-traumatic stress disorder, PTSD, Obsessive-Compulsive Disorder, OCD, and Attention-Deficit Hyperactivity Disorder, ADHD, which affect focus and impulse control. Eating disorders, like Anorexia nervosa and Bulimia nervosa, and substance use disorders are also prevalent. Additional disorders, such as schizophrenia, personality disorders, and neurocognitive conditions like Alzheimer's, highlight the broad spectrum of mental health challenges. By educating ourselves, we can help reduce stigma, offer support, and promote accessible treatment options.